Hi everyone, it's Dr. Jules here, and today I wanted to share a patient success story with you. So this particular individual sought out help due to the struggle of tinnitus. This patient has been suffering from severe tinnitus for many years. When they first came to see me, I had them fill out a validation measure known as the Tinnitus Handicap Inventory. It's a self-reported measure to determine the perceived severity as well as the impact on the individual's quality of life. We can't just go into somebody's head and figure out how severe the tinnitus is, so we use this validation measure to track progress throughout treatment. So on day one, before this patient started any sort of treatment, they scored a 90, which puts them in the catastrophic category. So there's mild, moderate, severe, and then catastrophic. So about a month later, I fit this person with medical devices that ultimately was going to help treat the tinnitus and hearing loss. A week after I first treated the tinnitus and hearing loss, I had the individual fill that tinnitus handicap inventory out again, and it went from a 90 to a 70, which is still a high number, but is a really big jump in 1 week of just properly treating the tinnitus and hearing loss. So now let's fast forward 2 weeks after that. So now this individual has been treating their tinnitus and hearing loss for 3 weeks. The tinnitus handicap inventory score went from a 70 to a 42, all in 3 weeks. That is a major success story. And not only is the individual treating the tinnitus and hearing loss, the person now enjoys going out to dinner again and going to, more crowded areas where they struggled before and weren't going because they couldn't hear. So now we addressed both things. The tinnitus is less bothersome to them, and they can hear in background noise. It doesn't get much better than that. So if you or somebody that you know is struggling to hear or is struggling with tinnitus, please come see me at Hearing Doctors of New Jersey to help treat your tinnitus and hearing loss. Bye.